Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. So without further ado, let's get into this week's article titled, Trigger Finger Steroid Injections. Are they worth it? If you've seen a doctor for aches and pains at any point in your life, chances are you've been offered a steroid injection. Steroids are anti-inflammatory medications that, when injected in an area of pain, can improve symptoms. But there's an important question to consider first, and it's often glossed over. What is the purpose of the injection? 1, to cure the condition, or 2, to temporarily decrease pain to allow other modalities like therapy or bracing to work better, or 3, to mask the pain for a period of time. Unfortunately, many times it's the latter. Take a badly arthritic knee as an example. A steroid injection isn't regrowing cartilage and thus curing the knee arthritis. Nothing can do that. The steroid merely decreases the inflammation and temporarily treats the symptoms until the cycle of pain renews. Trigger fingers are a bit of a different story. Steroid injections are extremely effective for treating trigger fingers, and in many, not all, can result in a true cure of the condition. It's pretty cool, so let's look at the data. As a brief review, a trigger finger occurs when a lump of inflammation accumulates on a flexor tendon. These tendons bend the finger when activated, and in a trigger finger, the nodule gets stuck on a band of tissue called the A1 pulley, resulting in clicking or even locking of the finger. If you're following along in the article, you can see a nice image of this phenomenon, and I'll be sure to link to it in the show notes below. So the steroid injection will actually coat this nodule of swelling and shrink it, resulting in smooth tendon motion once again. So what does the science say? For simplicity, the data I present today will be about single finger trigger fingers. We do know that patients with multiple affected fingers at once have a slightly lower rate of success from steroid injections. I'm also going to be deliberate about the difference between short-term relief, meaning did the injection work, and cure, which is long-term the condition is gone. These are different outcomes, but easily conflated if I'm not careful with my word choice. So looking at all the available studies out there, it's safe to say that the first steroid injection for any one trigger finger has about a 50% cure rate. While over 90% of first-time injections get short-term relief, I typically tell my patients by 6 weeks after the injection, 90% of trigger fingers are gone. The long-term cure rate of one shot is about 50%. That's pretty good. But what about the unlucky 50% of people? If your trigger finger either didn't fully resolve or it came back after a few months, the success rate of your second injection is almost as good as the first. The data tell us that you have a nearly 40% chance of cure with either the second or the third injection. And still, over 90% of these improve in the short term. These are good odds. In medicine, few treatments have this high of a success rate for such a simple intervention. Now, a couple words of caution if you're currently being treated for a trigger finger. First, it doesn't matter where in the palm your steroid is placed. Within reason, of course. Ultrasound guidance of the injection down into the tendon sheath has not shown any benefit compared to putting the steroid just under the skin around the sheath without any image guidance at all, which means it's not really justifiable to have our health system, or really you, pay for an ultrasound-guided trigger finger injection. Other conditions, it's absolutely justified. In trigger finger, not so much. Second, with a trigger finger and just about any other condition in the musculoskeletal system, a steroid injection in the near term before surgery will actually increase the risk of infection after surgery. So, if you're considering a steroid injection for a trigger finger, I would highly advise you to avoid any surgery on the same hand, trigger finger release surgery or otherwise, in the subsequent 3 months after that injection. That means if your steroid injection didn't work after 6 weeks, you will need to live with that trigger finger for another 6 weeks if you want to minimize your chance of postoperative infection. And trust me, you do. So a few takeaways from today. Trigger finger steroid injections are highly effective, both for short-term relief and long-term cure of the condition. Over 90% of trigger fingers will be gone 6 weeks after the injection. Long-term cure rates are 50%, 40%, and 40% after the first, second, and third injections, respectively. Surgery should not be performed within 3 months of steroid injection due to an increased risk of postoperative infection. So take this information and use it to make the best decision for your health. And if you need a refresher on the basics of trigger finger, I will also link to that in the show notes below. Education is the first step toward empowerment. Until next time, thanks for being here. See you then.